It's 6:24. The Royal College for GPs says foreign GPs working in the UK are being threatened with removal from the country by the Home Office. The college estimates that 1,000 new recruits are being sent letters telling them they're being sent back to their home country just weeks after they finish their training. Dr Ellen Welch is a GP and co-chair of the Doctors Association UK. Morning, Ellen.
Morning. How are you doing this morning?
Yeah, good, thank you. Can you explain what's happening and to how many people?
I can, yeah. So this was raised at an evidence session of the House of Commons last week, and the Royal College has been receiving letters from trainees who have got these letters from the Home Office threatening them with removal, basically. The issue is foreign doctors who come here to work as a GP, train as a GP, it takes 3 years to train as a GP, but you can't get indefinite leave to remain in the country until you've been here for 5 years. So there's a gap where their training ends and they haven't got a job where they need to find sponsorship.
Right. Can GPs renew their licence to get around that?
Well, that's the problem. Ideally, yes. We've got a situation in this country where we have got a steady decline in GPs. The country is crying out for GPs. The latest stats from NHS Digital show we're 1,500 fewer GPs down than we had in 2015. Despite this, the workload's rising. We've got problems with burnout GPs retiring early, but we've got a group of GPs here who are ready to start working in the UK, but because of red tape, they can't. So they need to find an employer to sponsor them. So one of the things we're trying to do at the Doctors Association is match practices who are struggling to recruit and can provide that visa with doctors who need it.
And how easy is that proving, doing that matchmaking service?
Well, the job's there. As I've just said, we're down on GPs, but if someone's got their life and their family in one part of the country and the job is in the other side of the country, that's not really a match. But all we need really, there's a private members bill which has been waiting on a second reading for quite some time to grant indefinite leave to remain to all health and social care staff in recognition of their efforts in the pandemic. This would just cut out the red tape and grant them that leave to work and stay in this country. But that's been waiting for the second reading for quite some time now.
What's the situation for GP surgeries across the country at the moment?
Well, I think we're all aware it's dire, to be honest. I'm a GP, and at the minute we are facing fewer colleagues. We've got a workforce crisis. Despite that, the struggles people are having getting an appointment isn't because GPs are not working. We have been working throughout the pandemic. We had 24 million appointments in April alone. Half of those the same day. 2/3 of those were face-to-face. And if you cut that down out of the weekends, that's more than 1.2 million appointments per day. So we're extremely busy. We're dealing with all the pandemic backlogs, all the 6 million people on waiting lists coming to the GP. The workload is immense, but we've got less staff to deal with it. And this is why patients are getting a raw deal, is because we haven't got the workforce to deal with the workload. So to tell a cohort of doctors that they can't work when we desperately need them is insanity, really.
The government has said that this is scaremongering, and they say, I'm just looking at what a government spokesperson has said, trainee GPs may use time between the end of their training and the end of their visa to look and apply for work. What's your reaction to that?
Well, that sounds very good on paper, but the reality is, if someone comes to the end of their training, if they have to perhaps extend their training, they won't pass their exams, if nothing's perfect and fits neatly into that box. So if there's a problem with that, if they have to delay for certain reasons, they've got a period of time where they can't apply for a job because they haven't passed their exams, and then what do? So it would just be much simpler to remove this red tape and give them the leave to remain so they can work.
Good to speak to you this morning. Thanks very much, Ellen.
Thank you very much. Take care now.
Dr Ellen Welch, GP and co-chair of the Doctors Association UK.